operation. So a couple of things to report today. No deaths to report to you for starters. We did have positive cases of 3,829. So this is below the 7-day average, and it gives further indication that we are at or about that peak here in South Australia. That 3,829 positive cases was made up of 2,860 which were PCR tests, and 969 which were the rapid antigen test results put through onto the SA Health website. I can let you know that yesterday we had 3,783 people recovered, and so you see now 3,783 recovered, 3,829 infected. We're about in equilibrium. In fact, over the last 2 days we've had more people recovered than infected in South Australia. Another indication that we are getting towards the peak of this infection. In hospital, we've had an increase up to 227, so that's an increase of just 7 people in the 24 hours to midnight last night. We've got the same number of people in ICU at 26, and in fact we've had a reduction in the number of people on ventilators down to 5. I think this is the lowest number we've had on ventilators in South Australia for quite some time. In terms of the testing yesterday through the PCR testing lines, we had 14,873, and then in addition to that we had the rapid antigen test collections. We had 6,324 in the city, and we're also very pleased 185 people to Berry Barmera. So of course double the amount of rapid antigen tests were delivered because people get 2 of those in their kit, but in terms of the number of people, and so the expectation that we would have had those tests yesterday takes us to a total of 22,282 cases or tests in South Australia yesterday. So I think from that perspective we're very satisfied with the testing rate in South Australia, the positivity remaining stable, hospitalisations, ICU and those on ventilators stable. Nothing like the situation that we had 3 or 4 weeks ago when we were seeing a doubling every couple of days. It is very stable at the moment. We can't be complacent. We're still dealing with a highly transmissible variant. We still see big numbers interstate, but we are starting to see some very, very hopeful signs that we're at that peak now in South Australia. Yesterday, in terms of vaccinations, and I sort of report this every Monday because Sunday is a low day in terms of vaccination. We don't have as many in the primary healthcare sector operating, but yesterday we did 9,632 vaccinations. In fact, I can report to you that the 7-day up to the 15th of January was 138,000 vaccinations in South Australia. This is an all-time record. In fact, it blows the previous record completely and utterly out of the water. But I'm not in the slightest bit satisfied. I want to see a lot more vaccinations this coming week. We've opened up thousands and thousands of additional time slots for people to go and have that vaccination. There's a brand new capacity which is starting down at Jubilee Pavilion at Wayville this week. We've got 1,000 of the 5 to 11 appointments every single day down at Wayville, and of course we've got the Enfield site which is also opened up. In terms of the staff who are positive and furloughed within SA Health, we also are now starting to see a moderation there. We have 567 positive people, so this is fewer than yesterday, and a big reduction in the total that are not able to be at work. So these are people that are either COVID positive or close contacts. This drops from 918 2 days ago down to 826. So we really are, I think, starting to even out on a number of the metrics now, and that's something that I'm very pleased about. And obviously, I can tell you that we're continuing to do our compliance checks in South Australia. Yesterday, 69 visits. There were no expiation fines whatsoever given out yesterday. There was still some some cautions in terms of just a bit of additional education, but the Police Commissioner informs me and informs the COVID Ready Committee on a daily basis now that, in fact, he's very pleased with the level of compliance that he's seeing right across South Australia. That's compliance from people that are out and about. It's compliance from businesses as well. So massive, grateful thanks to everybody in South Australia, businesses, the public alike, for doing the right thing to keep our state safe. As I mentioned to you on the weekend, we were concerned about reports of the ability for people in residential aged care facilities to live as normal a life as they were used to prior to Omicron. We're particularly concerned about visitation and also about workforce. And today we received a very detailed presentation from Professor Faye Jenkins from the Communicable Diseases Control Branch. She's the head of the Communicable Diseases Control Branch in South Australia. And we also received a presentation from Cassie Mason, who's the head of the Office of Ageing Well. What I can tell you is that we have just over 150 sites in South Australia who have experienced positive cases. There are 102 outbreaks in South Australia at the moment. Now, I do need to talk to you about the definition of an outbreak. An outbreak can be a single resident or 2 staff members. So sometimes when people think of outbreaks, they think there might be 50 or 100 cases. It's a very tight national definition for an outbreak, 1 resident or 2 staff. So we do have 102 outbreaks across South Australia at the moment, 1,192 cases, of which 572 of those are staff members, 615 residents and 5 visitors. So this is affecting about 2% of staff and about 4% of residents in South Australia. And this is at the lower end of the scale on a national basis. We are obviously looking to provide state government support for these outbreaks. It is varying support depending on a range of concerns in terms of being able to respond to the specific risks associated with that outbreak. It can be support in terms of helping with testing. It can be support in terms of the provision of equipment, personal protective equipment, PPE, and a range of issues that we can help with. My understanding is of those 102 outbreaks, we are classifying 11 of those which require some significant SA health support, which we supply. Obviously, the area of aged care is the responsibility of the federal government. They have their Quality and Safeguarding Commission, which does the audits, but we in South Australia want to help in any way that we can. There was further information provided from the state government to all of the residential aged care facilities last week, reminding them of the arrangements in terms of visitation in South Australia. It's fair to say we're going through a transition period. The numbers of outbreaks are very much higher than what was modelled under opening the borders for Delta. Omicron, less severe, but far more transmissible. So there is a higher number of these narrowly defined outbreaks in South Australia. But we're very confident that the residential aged care facility is getting on top of this and will provide greater flexibility with regards to visitation going forward. The major issue for the aged care sector is workforce. This is limiting the ability for the increased visitation on these sites. And so it was agreed at the COVID Ready Committee this morning that Professor Nicola Spurrier will revise the return to work framework for residential aged care facilities in South Australia. That will be completed in the coming days. And I'm sure that what that will do is just provide that workforce relief in a careful way that will start to ease some of those concerns in our aged care sector. Obviously, it's an important sector for us. It's a vulnerable sector, and we want to be doing everything we can to support them. So look, that's where I'll leave my presentation. I'm happy to answer any questions. Then I'll pass to the state coordinator, who will give you an update on the rollout of additional rat collection places. I know the Commissioner was very pleased with the way that the Berry Barmera site went yesterday. There were a large number of kits which were collected, and of course I've already reported those positive statistics to you.
Are you going to revisit
what do you mean by greater flexibility with aged care facilities? Can you elaborate on that?
So obviously in the early days when we experienced far higher levels of outbreak than was anticipated and much higher impact upon workforce, it did require or necessitate that some residential aged care facilities had to narrow their visiting time down. They did it for two reasons. One, because SA Health liked to get in initially to do an assessment on the risks, and so they had to essentially close it to visitors. But the second is, with the diminished workforce, they didn't have that workforce to process people in terms of arriving onto the site. So this is why I think we'll start to see easing over the coming days, especially when we can revise that workforce plan. But we did have discussions with the aged care sector right throughout the weekend. They all realise that the more that residents can interact with their family, their friends, their loved ones, the better their quality of life. They're all committed to making sure that we can do this as soon as it's safe to do so. Yes, so as I was saying, Professor Nicola Spurrier will be revising the return to work for aged care staff in the next 48 hours. We'll take another look at it tomorrow at the COVID Ready Committee, and that will be ready for publication. That will just provide a nuanced environment for bringing staff who may be close contacts back into the workforce. We need to do this in a careful and considered way, and that's why Professor Spurrier is taking a look at it.
Just to follow that up, Premier, could that say potentially include people who have tested COVID positive return to work potentially after 7 days rather than 10 days? Is that one of the options on the table?
Look, there are discussions at the federal level at the moment with the AHPPC today. Professor Spurrier's at that AHPPC meeting at the moment with regards to shortening times. I think we've said right from day one, there's a progression of restrictions and TTIQ that you put in at different stages. Some states, of course, are at a different point than we are here in South Australia. Some of them are contemplating, I understand, shortening their quarantine times down. At the moment, we are the longest in the country at 10 days. Most other places are at, well, I think all other places are at 7 days. We'll continue to look at these settings, but you know, we've been very concerned about having a peak which would overwhelm our health system here in South Australia. We've been very fortunate to have the cooperation of every person in South Australia to get us to the point we are at the moment, but we'll constantly look at whether or not we can ease some of those restrictions, and that means that people will be able to get back to work or get on with their lives much earlier.
Are you going to revisit the rules around return to school, particularly if the teachers threat of a potential strike, and particularly around their close contact rules where they might wind up being a close contact time after time after time if the residents get back in that area?
Well, look, each state is going to have to deal with exactly the same issues. In fact, many other states are going to be returning back day one. We've got a staggered return in South Australia, which was determined on the advice that we'd received at the COVID Ready Committee. We've put that into place now. I think it's too early for the unions to be talking about striking. We still haven't finalised exactly what that return to work strategy is going to look like. We've got the bulk of our strategy out last Friday. Of course, we're the first state in the country to do so, but we did say that we needed a bit more time to work through with the National Cabinet the use of the RAT tests, the rapid antigen tests, to aid that return to work. So we should have better advice coming in the coming days.
Do you understand why teachers would be concerned about the situation where they might be a close contact day, week after week after week, and might find themselves in isolation effectively indefinitely?
So no, we've got provision in place for teachers to be able to return to work. I think their major concern is, are they going to be in isolation outside of work? And we're working through those issues at the moment. We did discuss it in a preliminary way at the COVID Ready Committee yesterday. We're seeking further advice. We would really like to get a handle on exactly what's going to go through National Cabinet on Thursday this week with regards to the rapid antigen test. But I'm quite confident that we'll be able to find a middle course that will satisfy. It's going to be a disrupted start. It's going to be a disrupted start to term one in South Australia, right around the country. But I think we've got the balance right, and we certainly want to work with our teachers and our principals, our school support officers, the councils, to make sure that we can navigate a way through which is going to keep our students and our staff at a lower risk than many other places.
Could I just return to aged care for a minute?
Yes.
With the definition that you've given of 102 sites,
Yes.
if I remember correctly.
102 outbreaks, 154 sites.
Correct. Do you have details on how many of them are effectively in lockdown, or is that those 102 sites?
No, look, there'll be very few that are in lockdown. As I said, if an outbreak is declared, we do like to have that opportunity for SA Health to go and do an assessment. So they would be ones that are off-site, or if there were very significant workforce shortages that couldn't be addressed. And I probably would shy away from using the term lockdown. I just think it would be reduced visitation arrangements, because there will still be a lot of people that are going on and off sites. But look, it is a vulnerable community. There's no doubt that our residential aged care facilities, people co-located, more fragile health, are more vulnerable. And so we do want to protect them, but we've got to get the balance right, because we know that keeping people in their room and keeping visitors out, which might reduce some risks, will increase others. And so we want to get that balance right. And I think the discussion today, and certainly over the last couple of days, has been very useful.
Premier, just while we're back on aged care, just very briefly, you say the state's happy to step up and provide more assistance when it comes to PPE. What about more assistance when it comes to providing booster shots? Because we know obviously that's a federal program as well. Can SA Health step in to fill the breach there as well?
So I might have reported this 2 or 3 days ago, but I'm happy to provide a further update. So Lieutenant General John Fruin gave an update to the National Cabinet, which was held late last week, where he said that all of the boosters would be administered by the end of this month. In fact, he was already talking about going back and doing subsequent visits to residential aged care facilities, because not every person got theirs in that sort of booster round. So he's already going back. We've got plenty of shots available. Don't forget, a couple of weeks ago, we had much greater demand for vaccination and boosters than we had supply. It's the other way around. You can turn up today and get a vaccination, an adult vaccination in South Australia. We still do like, and the clinicians want us to emphasise, with the paediatric doses, the 5 to 11, they do like those to be booked in. We know that this does decrease the anxiety for children attending those paediatric vaccinations. I chased that up yesterday with Rachel Carr. Said, you've got all this spare capacity down here. Why don't we just tell people to jump in their car and bring their kids down? And she said, look, there's very good clinical reasons why we like the kids to be booked in, but there's so much capacity for vaccinations in South Australia at the moment. We're doing extraordinarily well, especially with our boosters. I think we're top of the entire country at the moment in terms of the administration of our boosters, and we're opening up more and more time slots every single day. Yes. Yeah, so we've got a huge shipment coming in today. 426,000 rat tests are coming in today, and I think we've got about 250,000 additional rat tests coming in every day between now and the end of January. So they are really starting to flow through. Now, we're going to need them for our own purposes and potentially also for our schools when we get a final position on that. And of course, we are handing out a huge number of free kits via this collection site here. In fact, we've already well past 70,000 free rapid antigen tests delivered from the parklands here, and there are more and more sites opening up all of the time. With regards to that question, Andrew, it was really PCR and trying to get some quick turnaround for them. Obviously, with some of the older residents, it's hard for them to get out and get to a clinic, so we're happy to help. I know it's the federal responsibility, but we work very well with the aged care sector in South Australia. And don't forget, of all of those sites in South Australia, quite a large number of them are SA Health sites. We have a disproportionately high number of SA Health aged care sites compared to other states. That's mainly because in the country, our country hospitals are also aged care facilities. So look, I suppose what I'm saying is when there is an outbreak, narrowly defined, even a single resident or 2 staff members, we're there. We're there to say, how can we help? Look, the vast majority of sites have already adapted to where we are at the moment with Omicron. Some need some additional help. One instance, we just helped because they needed some help with taking waste away. There's a bespoke approach to every single outbreak where they're in partnership with these residential aged care facilities and the Commonwealth.
Tony, can I just again clarify with the flexibility? I understand about the workforce issues, but with the flexibility when it comes to visitors, are you saying that aged care facilities over the coming days will be able to further expand the visitation hours or ease the rules when it comes to residents being in their rooms?
So just to be clear, we don't have oversight of the aged care facilities, so they can put their own rules in place. We have some of our own rules as the minimum standards, so we did limit the number of people that could visit a site if that site had a residential vaccination rate below 70%. Now, I'm not aware of any in that instance anymore. So we can control it from a directions perspective, but we can't force a residential aged care facility to be open. But can I just say, in all of our discussions with the sector, they do want to have increased visitation in a safe way. And what they're doing with us is working with us, and Professor Spurrier in particular, with that return to work. There is a global health workforce shortage. We are not immune from it here in South Australia, so we do need to, as we get further into this disease, look at ways that we can safely return workforce back into the workplace, and that's what we're going to be doing with the residential aged care facilities over the coming days.
There have been some fabricated reports of mortality in the eastern states. Can you assure people that that's not the case and that these are fabricated, and you have a message for people about where they source their information from?
Look, we were very concerned in the early days, especially with low vaccination no vaccination for those under 12 in the early days. So we were keeping a very close eye on this. What I can tell people is we've seen no evidence of increased hospitalisation. We haven't had a single child into the ICU at the Women's and Children's Hospital. And I think this must give a lot of parents a lot of hope that despite the transmissibility of this disease, the severity is very, very much at that lower end of the spectrum.
What we're talking about is
some schools, Labor is claiming that a air ventilation audit at schools has not been finished, and that principals were given clipboards to test if windows open, that kind of thing. Is there any truth to that, and what kind of assurances can you give parents that when they do send their kids back to school, that they're sending them into a safe environment? Yeah, look,
we had this sort of scare campaign being run last time we returned students to school in 2020. The reality is, I know it's going to be anxious time for some, but we don't need Labor out there undermining the public health messages on a daily basis. A comprehensive survey of ventilation in South Australian classrooms was conducted. It was supervised by by the Department for Education with input from SA Health. Professor Spurrier herself has overseen these results. She's very happy with where we are. I think she's spoken now 2 or 3 times in the public about the lack of need for widespread air purifiers that have been put around by the Labor Party. Apparently they want us to put one into every single room. This would just be an inappropriate use of this device. I think there's only one other state in the country that's even contemplating this, and look, they can get their own health advice there. So I'm very, very satisfied that people will be able to return to school safely when term resumes. We're doing it in a staggered way. That's a bit different from some states. Some states have got everybody going back on the same day. I wish in some ways we could, but the overwhelming advice that we received was that we would avert 20 to 30,000 additional infections in the month of February by having this staggered start. That's the advice that we received from Professor Joshua Ross from the University of Adelaide. He's part of that Doherty Institute group right around the country. He's done a great job and will continue to abide by that advice that we've been receiving. Rory.
Premier, can I ask you about some evidence that was given to the Budget and Finance Committee this morning from the Under-Treasurer David Reynolds relating to the COVID Ready Committee?
Yes.
He has essentially told the Budget and Finance Committee that it's not a decision-making committee. So if that's the case, what does the COVID Ready Committee do?
Well, the COVID Ready Committee is the peak. It's the controlling committee, I suppose. It coordinates all of the activities. But if a direction needs to be put in place, it's not put in place by the COVID Ready Committee. It has to be put in place by the state coordinator. When we did our capacity planning, all of that was decided at the COVID Ready Committee, but ultimately it needs to go through the cabinet for that approval. So look, it's ultimately the peak coordination and controlling committee. It's got a core group of people who meet on a daily basis. We met on Christmas Eve, Christmas Day, Boxing Day. We met on New Year's Eve, New Year's Day. We've met every single day. People have all put in a huge amount of time and effort. As I said earlier in the press conference today, we had Professor Faye Jenkins from the CDCB with us, and we also had Cassie Mason from the Office of Ageing Well. I think tomorrow we have representatives from the Department for Human Services. Obviously, they're looking at the disability sector. They're looking at the Aboriginal communities in South Australia. So we have a rolling group of people that are coming to look at different aspects. We've got Professor Joshua Ross back in the next week, giving us an update on the model. But the core is, of course, myself as the chair, the health team, the SAPOL team, and the DPC team.
As a follow-up to that, the evidence was also given that there was no agendas, minutes, any type of formalised reporting of the meetings. What do you have a response to concerns that while it's doing excellent work and it's got excellent officials on it, there may be a problem with some due diligence?
No, I don't think so. I mean, I think it's similar to most advisory groups that sit within government. If there's an action to be taken, it's during another mechanism. It's quite possible we'll revise this. So I have said that we will revise the Emergency Management Act after this major emergency declaration. We didn't want to do it in the midst of it. I think the Emergency Management Act has some limitations. It was really set up for a sort of a very short-lived emergency like a fire or a flood. Wasn't really set up for a global pandemic. I think it served us well, but I think there are ways that we could improve that. So we are already committed for a review after this major emergency declaration is removed, and then a review of the overall Act when Parliament resumes.
In regard to
Look, it's hard to say, Andrea. It's a very good question. Look, a forecast is exactly that, and it really does depend on human behaviour. One of the really obvious things in South Australia is there has been significant reduction in mobility. People are working from home if they can. They're reducing their interactions, and this has probably had the effect of dampening where we were heading. I'm still 100% confident that if we didn't take the action we took on the 26th of December, we were undoubtedly heading for 30 to 40,000 cases per day in South Australia. Our doubling rate was frightening. Now it is, in a very, it's a very comfortable place. We can't be complacent just yet. We do want to see the cases doubling. We want to see the number of people in hospital reducing. But the model is just that. It tells us if we don't take action, everything being even, this is where we're going to be. Now, what it showed is if we didn't take action, by right about now, we would have been admitting 600 people into hospital every single day. Now, we saw a rise overnight of 7. And in fact, we see the number in hospital today lower than where it was a week ago. And so that's a very comfortable position to be in at the moment. It's still putting our health resources under enormous stress. So we do want to come out the other side, but I'm pretty confident that we're at that peak at the moment.
What sort of impact do you expect from a major retailer putting a hold or a ban on taking products from teas and
I haven't seen that, sorry. Look, obviously Tees has been affected by an Omicron outbreak down there. I do think that the management there have done a very good job. Keep in mind, this was not an Omicron outbreak at Tees, this was an Omicron outbreak in the local community which spread to Tees. They've been working very, very closely with SA Health to make sure that they can continue to operate in a risk managed way. And so I'm very, very grateful to management there, the local government sector there, the local member of parliament there. Everybody's working together. It's a difficult situation. We have difficult situations right across the state, right across the country with Omicron. And what we're doing is every time we identify one of these, we rapidly respond. It would be disappointing if a major retailer was no longer taking meat from South Australia, from down at Tees. I think they've done an excellent job controlling the outbreak, and I think that we're just about on top of the issues down there. Did you want to have one last question?
When you say that you're confident that we can take, how long do you expect this sort of peak to last? How long are we probably expecting to see the numbers in the 3,000 or 4,000?
Yep.
Might we see a drop off in those numbers and potentially an easing of restrictions?
Yeah, so in the past what we've done is we've looked at one day versus the day before. Now we're really looking more at the 7-day rolling average. There will be days that go higher, there'll be days that go lower, but when you consistently have days which are lower than the 7-day average, then it gives you some confidence that you're getting towards or at that peak. Now, where it goes, it really is dependent on human behaviour. Obviously, people in South Australia have been fantastic at reducing their mobility and working from home where they can. We don't want to see all of a sudden a massive increase in mobility that would set it off even further. We want to bed in this situation. As I said, we're really keen to get Professor Joshua Ross back to the COVID Ready Committee in the coming days so that we can get an update. And then, of course, just like we have in the past, we'll be providing that to the people of South Australia, in particular to all of those people that are working in our healthcare sector. I think that when they see these numbers stabilising, must be a great sense of pride for them, the great work that they've done to keep our state safe, and I'm very grateful to each and every one of them. I'm going to pass over now to Commissioner Grant Stevens. This is his first press conference since Boxing Day, the 26th of December. I've got to also say, some people say, oh, well, you know, he's been out of action for 10 days. He did not miss a single meeting of the COVID Ready Committee. Now, he can tell you about some of his symptoms, but I tell you what, there was no change to his work ethic whatsoever. We're so well served by our Commissioner and, of course, by South Australia Police in general right throughout this period. So I'll pass over to the Commissioner now.
Thanks, Premier. Just in terms of the rapid antigen test collection sites, I can advise that tomorrow we'll have sites operating in Port Augusta and Murray Bridge. And then on Thursday, we are planning to open sites in the Port Adelaide Enfield Council area, as well as the Mount Gambier district. And on the Saturday the 22nd, we'll have sites operating in the Charles Sturt local government area and Narracourt. And on the 24th of January, we'll have a site in the Onka-Paringa Council area as well. Planning's underway as well to establish sites in Playford, Salisbury, Mount Barker and Port Lincoln, and I'm sure you can appreciate from the scene behind us, there are significant logistic issues in standing these sites up, particularly complicated by the fact that some of these are being established in regional locations, as well as the staffing issues that go with making sure we've got the right people available to issue out the tests, deal with the procurement and the distribution of those tests at the different sites around the state. So a fantastic team effort right across the board from a range of different agencies within the public sector. Great support from the local government association and local councils and the other emergency services to see this establishment behind us up and running and operating very effectively, and the work that's being done to establish these other sites as well. There is some thinking being put into place now about pop-up capability as well, so if we have a particular need in certain locations, either in the metropolitan or regional areas, that we can establish a quick delivery of those rapid antigen tests to those locations. That work's underway at the moment.
Have you been pleased with the operation of this site?
Extremely pleased. And it's fair to say that when we were putting the work in to establish this, we had no real capacity to properly forecast the demand for the rapid antigen tests through this free pickup location. And we were forecasting potential for significant numbers, and the last thing we wanted was for people to be unnecessarily delayed in coming through the site and picking them up and moving on. What we've seen from day one is there's been a steady, even flow, and it's taking people in the order of about 4 to 8 minutes to get from the entrance to the site to the other side. So I think that's a great outcome, and we'll see what that looks like as we move forward. We may see increasing demand, and it may wane as we provide access to other sites going forward.
The other issue with the operation limit, there was an instance last week of a gentleman in Golden Grove who was fined twice, and then that expiation was withdrawn. Are you concerned that there are aspects to this operation that might be seen as heavy-handed?
No, look, I think we can stand on our track record in relation to how we've been managing the obligations that businesses and individuals have during the major emergency. By and large, police are out there supporting the community, giving advice, giving people a warning where it's appropriate, and only taking action in relation to issuing an expiation notice when we see a blatant disregard. The situation in Golden Grove was regrettable. The 2 fines issued, the second fine was never valid. It was an administrative error. And when on reviewing the circumstances, it was clearly the case that a warning and education was the most appropriate course of action in that situation, and that was rectified.
And what about operation limit in general? Are you generally happy with the compliance in an industry which is quite critical of these measures?
Once again, our performance right throughout COVID-19 in South Australia has hinged hugely on the willingness of the community to do what's required in order for us to manage this pandemic. We've seen that day in, day out, people doing the right thing, or at least trying to do the right thing, and responding well to the advice we give. Operation Limit is out there to ensure that we are seeing that sort of compliance that we need, and providing support to those businesses that need it where we identify that. And we're seeing overwhelming efforts to comply with the restrictions. Notwithstanding, it does have a massive impact on their ability to run their businesses effectively. I'm not advised of any issues. The direction requires you to upload your results in accordance with SA Health's requirements, and SA Health have required that you must upload a positive result, and they're strongly encouraging people to upload their negative results so we get as clear a picture as possible as to what's occurring. And that's just a reminder to everyone who's coming through this site now. Once you've picked up your test and you go home and do it, please upload your results. We specifically want positive results, but we encourage everyone to upload the negative or the positive or the inconclusive results, so we get a clear picture as to how the rats are working and the impact it has on our case numbers on a daily basis.
Just further to that point, Commissioner, what impact has having this centre up and going had on our PCR lines in the last couple of days? Can you talk us through that? Has it had a good effect?
Well, it appears to be having a very positive effect. We've seen a levelling out of the demand for PCRs, and enabling close contacts to come here and pick up a rapid antigen test in preference to lining up for a PCR test seems to have balanced out that demand for all of these tests, so that's got to be a good thing for everybody. Getting rid of those long waits was something I think everyone was keen to see.
And then as a follow-up to Rory's question, Commissioner, have you had any issues in regards to potential breaches of the direction when it comes to rapid antigen testing, either education or expiations?
No expiations have been issued for anyone regarding their obligation to upload their results. And there's been a lot of emphasis about the fact that you might get a $1,000 fine for not uploading your result. It's worth pointing out that in order to communicate with people what their obligations are, it has to be written into a direction. And because it's in a direction, it may attract a fine. We're not out there to issue fines to people who don't upload their results. We know people are here to collect the RAT so that they can find out whether they're positive or negative. And I'm absolutely certain people will do the right thing and upload that result. We just need a way to be able to communicate people's obligations, and that's what the direction's all about.
We obviously, the Premier mentioned earlier about SA Health staff that have been furloughed at the moment.
Yep.
How's your workforce?
We have, as of today, we have 129 police officers have tested positive and are quarantining, and in the order of about 180 police officers and staff who are currently isolating because they've been identified as a close contact. So we're talking around 300 staff per day are absent from the workplace as a result of COVID. At this point in time, we're able to manage that. It does put some stresses on us in terms of our operational capability, but not to the extent that it impacts on the service we're providing.
Just on another topic, something that we might not be that familiar with, but there's been a roadway incident at Paradise yesterday where a motorcyclist came out of a car.
No, sorry, don't know about that. Look, any offences of violence are of concern to us. We will investigate all of those sorts of instances where they're brought to our attention. Road rage is a particularly difficult issue for us. We encourage people to use our roads responsibly and safely, and there are often occasions when you need to exercise some patience and just take a deep breath before you react to situations that occur on our roads.
Commissioner, just briefly back to the COVID Ready Committee. What discussions have been taking place in that committee over the last week or so about the return to school? And what's your view? I mean, you're ultimately a state's emergency coordinator.
So,
do you have a view?
Well, I was participating in all of those discussions. Detailed briefings were provided by the Minister for Education and the Chief Executive of Education, and the plan that's been put in place was based on the strong recommendations from the Chief Executive of Education, and supported by, as the Premier said, modelling from Adelaide University in terms of what the impact would be on potential case numbers. There is no role for me as the state coordinator at this point in terms of a requirement for a direction about return to schools. It is being managed by the Department for Education in collaboration with independent schools and Catholic schools. So it's not something I'm specifically required to make a decision on or to issue a direction on, but I have been party to those conversations.
So are you looking to, is there a possibility of directions when it comes to returning to school?
I'm not aware of any requirement at this time. It is being managed by the Education Department. Well, there's a balance here. It's about case numbers and it's about vaccination rate. We need people to get their booster. As the Premier said, there are thousands of appointment times for people to come along and get their booster. The sooner we get those high numbers of boosters in South Australia, the more quickly we'll be able to look at how we can relax these restrictions and enable businesses to operate more effectively. So I don't think we could be any more clear on the need for people to line up and get their boosters as quickly as you're eligible. Please get in there and get the boosters. Then we can start lifting these restrictions. Well, the goal is to have people come along and get their booster as soon as they're eligible. But what we are looking at, and this is where the modelling is really important, is the percentage of people who are fully vaccinated, including the booster, impacts on the potential case numbers on a daily basis. So we're looking at the modelling as well, and that changes on a daily basis as more people get vaccinated, and we see that we're actually coping with what's happening in South Australia. Thank you.
Thank you so much, Commissioner. Oh, is that his detail? Right.
Very good.